Hi, I'm Michelle Penrose with Henry Schein, and welcome to today's Schein Chat. I'm here with Kelly Jakes, who is an extraordinary professional speaker, actively involved with ADHA, a blogger, and an author.
Yeah.
So thank you for being here today, Kelly. It's just great to see you. I've had an opportunity to have Schein Chats with a lot of leadership in ADHA, and the discussion's always really great. So we're really pleased because you as past president of ADHA and your continued involvement, we really want to discuss how your career, the evolution of your career, and how you're still involved with ADHA. So thanks for joining us.
Well, thanks. It's great to be here, Michelle.
Good. So we're going to have a conversation today, something very near and dear to your heart. I know that, Kelly, and we're really excited about this. So the oral health and the correlation to total health has really become a very important movement.
Yes.
And a very important trend. So I'd like you to share with us why you think that this trend is so important right now.
Well, oral health and total health, it's kind of been on our radar for about 14 years. Like that's when the first research started coming out that, the oral health is very much connected to whole health. And I got involved with it way back when I was doing my master's degree, like 2007, 2008. And I did my whole thesis on what is the dental hygienist's role in interdisciplinary collaboration, meaning, the hygienist needs to speak with medical professionals about their patients and about the patient care that we need to deliver and not be in silos anymore, right? The mouth is not disconnected from the body. So I find it like a real fascinating subject, and there's new research coming out monthly, right?
Yeah, it has been around for a long time, and it's just interesting to see the evolution of, the importance of oral health to overall health. So what, and I know you're passionate about this, but how does this relate to dental hygienists? Like what can you impart to them? Because it's so important, and oftentimes the patient, the first point of contact in a dental practice is with the hygienist.
Right.
So they have the first opportunity to kind of influence and start this conversation. So share with us your thoughts on that.
Well, I really think the dental hygienist has a very empowered position in this whole industry of oral to total health, because you think about it, a hygienist will take first your health history. They're asking not just about your oral health, but we're asking about your heart health, your diabetes, all kinds of systemic situations that we want to know, because we know as hygienists how those systemic health issues affect the oral health. So we're right in that position already to be the ambassador, to talk to our patients about how what's happening in the mouth has a real great effect on their overall health.
And I have seen in my own dental practice, I know when I go to the dentist, the hygienist, I've seen the transformation of the role of the hygienist in my own dental practice with the oral cancer screening and having a different conversation and being in a dental profession. And so Henry Schein works so closely with ADHA. It's just great to see that in my own dentist's office, that how that's how that's evolved. So, in light of that, maybe you can give us a little bit of the science and the effects of this with dental hygiene and the profession.
Well, what's really exciting to me is the science of inflammation, because now we know periodontal disease is an inflammatory disease. But when you look at all the other disease states, including heart disease, including diabetes, including rheumatoid arthritis, including even obesity, these are all based in inflammation. So now we see how they're connected. These are all inflammatory diseases. And so you can pick up any dental journal, any dental hygiene journal, magazine, trade review, and everyone is talking about some systemic health system related to oral health. So I find that super exciting. In my own life, my father had severe periodontitis, and we could never get a hold of it, there are various reasons, but he also suffered from many inflammatory systems and diseases in his own body. He had ankylosing spondylitis, which is an autoimmune disease attacking his spine. He eventually got prostate cancer, which is an inflammation disease, and eventually we lost him to a sudden and fatal heart attack, and all of that is inflammatory based. So I find it super interesting and empowering that as a dental hygienist, I can talk to people about what's happening in their whole body, and it has a very strong connection to what's happening in the mouth.
So you commented that it's frequently written about, And I know you just wrote a book.
Yes.
And so the goal is obviously we want to get more hygienists and dentists having this conversation with their patients.
Right.
So elaborate a little bit more about how specifically this relates to women's health. I know this is
Yes.
a part of what's in your book, so
Right.
share with us your thoughts on that.
Sure. My book is called Martinis in Menopause, and it's about women's health as we go through the menopausal journey. But when you look at women in general and oral health, we are affected by the hormonal levels within our bodies, our whole lifespan of the woman. So when she comes into her reproductive age, right, and a woman starts having menstruation, with all those hormonal changes, that affects the gingiva. It affects the tissues within the mouth, and dental hygienists will often ask a young girl, how are you doing with your menstruation? Where are you in the cycle? Because we know it affects the tissue. Same with pregnancy. Right? So much hormonal changes within the female body also can affect the oral cavity. And the same we discover now as a woman leaves the reproductive zone and goes into menopause. Also, the changes of the hormones affect the oral cavity. So I find it very fascinating that as a woman, there's a lot of research and study about how we in particular are more prone to caries, we're more prone to periodontal disease over the lifespan of the female.
So again, this is such an interesting topic. We could talk, for hours here. But before we have to wrap up, if you could summarize for our viewers, what are some real key takeaways you'd like to impart from this conversation that hygienists can start doing with their own health? It's got to start with us first, right? It's got to start with us first, their own health, and then implementation of this in the practices they work with. Or what would you impart with our viewers today?
Well, the first thing I tell people everywhere, women and men, is you need to take care of yourself, self-care. And women in particular, and the hygiene industry is changing, but we're still over 95% female. And females tend to take care of other people before they take care of themselves. So my message is self-care, take care of yourself. But also, how can we empower the dental hygienist? I think there's 3 ways. First, empower yourself with knowledge, so you understand what this inflammatory link is between the disease that you treat and the diseases of the body. Then I think empower your practice, bring in some of this new research, talk about it at a staff meeting, and empower your practice to talk about oral and systemic health, right? And then finally, of course, the hygienist is key to empowering the patient to understand how important their oral health is to their total health. So I think we have 3 key ways: educate yourself, empower your practice, empower your patient.
I think those are 3 easy takeaways, along with first starting with yourself.
Yes.
And your last point really is critical, to start empowering the patients.
Right.
Make sure it's a simple conversation of how important good oral health is to overall health.
Exactly.
That's a simple conversation that can take, can go many directions, and it's critically important. And it's one of the reasons that Henry Schein really enjoys our relationship with ADHA and having an opportunity to spend time with people that are real advocates on relevant topics and future trends, because we feel very strongly about it. We're very much behind this movement. We work with our dental practices to try to start this conversation as well.
Yeah.
So if they're not doing these things in their practice, when we have conversations with hygienists and our dental customers, how important this is, because it's really going to save lives.
Oh, it's absolutely.
Yeah.
And that's the most empowering thing as a dental hygienist,
Yeah.
that you are going to save someone's life by the knowledge and the empowerment that you give to them.
Well, Kelly, on behalf of, like I said, we could stand here all day and continue to talk about this, but on behalf of Henry Schein, it was so great to spend a few minutes with you. Thank you for sharing your time with us and imparting all your great knowledge. Good luck with your book.
Thank you.
And have a great rest of the day.
It was great, Michelle.
Thank you, everybody.
Thank you.